Rock and roll.
So good morning, everybody. We're going to call the Appropriations Committee Higher Education Subcommittee State Agency presentations to order. We're going to start with the Office of Higher Education, and we have Executive Director Larson will present for the agency. Sir, the floor is yours.
Good morning, senators and representatives. Appreciate the opportunity to speak to the Office of Higher Education's budget presentation here at the Appropriations Committee. We have provided you with some backup for today's meeting. Ostensibly, we are represented today here with Jackie Lucier, who is our Division Director for Programs and Student Services, Ram Abastaria, who is the Division Director for Finance, HR, and IT, and Noel Kidney, who is my executive assistant, my legislative liaison, and our public information officer. Sean Seepersad is the Director of Academic Affairs and is not able to join us today. We have our hands full with a situation with one of our professional occupational schools. So he's back at the office managing that. To the extent that I can answer questions for you, willing to do that, but just in general, this is effectively a status quo budget. We certainly support the governor's opportunity and the historic tax cuts that this budget has presented to the citizens of the state of Connecticut. And to that end, I believe that we're well served by this budget, et cetera. There are obviously some, I'd be remiss if I didn't say that there are always opportunities for us to gain some more progress, but times as they are and be it as it may, I think we can suffice with what we have. So with that, I have staff here that's available to answer questions, and if you have any, we're ready to do so.
So thank you. So if we could go over staffing for a minute, because we're going to be asking this question for any of the agencies. How many staff do you have and how many open positions? I have down as 26. Do you have open positions too?
That's correct. We don't have any open positions at this particular point. Is that accurate? That's accurate.
Okay, so you have 26 of 26 are hired.
That's correct.
And relative to the Roberta Willis, we have added more money. Do you use the Roberta Willis scholarship funds and do you disperse them? How does your agency interface with Roberta Willis?
Sure. So last year we actually introduced what we refer to as the Connecticut Scholars software program after about 25 years of using an old access database and trying to sometimes manually figure out and distribute funds. We were able to modernize this with a brand new software system that will not only be able to interface with the colleges and individual students, but it's our responsibility to take in FAFSA information, discern what eligible applications we can put forward, and then divide up and distribute those funds accordingly to those respective colleges on two fronts, if you will. There's a need and a need merit situation. Ram Abastaria is here. That maybe can develop that a little bit more. We have met with the Higher Education Committee and want to have a more rigorous discussion specifically on how that functionality works and so forth. But we're not a policy agency, we're a compliance agency. So you tell us how to distribute the money and we're happy to do that in a professional manner. And then obviously go back and audit and make sure that all of that is in hand. With this new software system we have, we can actually, I'll call it geofence, where scholarship money is going. We can't give names of students to you, but we can basically by zip code tell you where funds are going. So it's interesting, it's dynamic. It's a better resource tool so that we know sort of where pockets are, et cetera. There has been some new federal legislation that's come our way. We're working with the governor's office right now in legislation. We're working with statute that requires us to follow a form from the FAFSA information that we get. Federal government has changed that FAFSA to what's referred to as a SAI formula. So we're going to be looking to coordinate with you what I would refer to as a technical language change that will allow us to, rather than use FAFSA, which has been changed by the federal government, put the new language in our statute and then distribute funds accordingly. That change will not affect the distribution of funds for the 23-24 academic year.
What will it affect? Because we're working on fiscal 24 and fiscal 25. Will it impact the 25 year?
You know, we need to maybe talk about that. In my mind, I don't think it's necessarily going to change the metric of how we distribute funds, but we're still sort of looking at that.
And so your agency is responsible for distributing Roberta Willis throughout all schools that get Roberta Willis, private, public,
Correct.
all agencies.
All Connecticut colleges for only Connecticut schools. I don't believe that Post University is eligible for Roberta Willis money because it's a private institution.
Private for-profit.
Private for-profit, correct.
But all private nonprofits or any nonprofit,
All of
whether
the publics,
private or
all of the
public.
independents
Do you
and
also-
Charter Oak.
Do you also distribute the PAC money too?
The PASS money.
PAC, P-A-C-T, the
Is that your program? No.
okay. Because it's mostly for community colleges anyways, and so I didn't know if you were responsible for that. Does anybody have any questions? Representative Walker.
Good morning. Good morning, sir.
Good morning, Representative. How are you?
I'm wonderful, wonderful. It's Wednesday. First of all, I thank you for what you guys do in trying to get the distribution out. But I'm gonna go into what I've heard from kids, and I heard it, and also administrators, is that the community colleges are the ones that have they receive their funding late into the fall semester every year. Can you talk to us about why that is and how do we fix it?
So I don't know that we distribute the monies different to the community colleges than we do everyone else.
Well,
So our formula and our process is pretty much the same. The concern or the problem is when the funds are actually allocated to our office. So we wait for the entire budget process to work its way through. We get that allocation and then we distribute those funds. So it may be purely a timing issue. There's no really selectivity on or detriment to any college. As we get the money in, we process those applications and then filter it back to those colleges. I can maybe Mark French, who runs our program, is not available today. What I'd like to do is we offer in our testimony here the distribution of funds over several years. What I'd like to do is maybe have Mark write back to you and comment specifically on how we handle that. You know, in plain terms, you know, ideally, if we could allocate 2 years of money sort of ahead of time, we would beat that. You know, we're caught in between the fiscal year and when students are applying for the money. So if we had the advantage of escrowed funds, for the lack of a better term, we may be able to solve that problem quicker,
So
more
has-
expeditiously.
ever since we started the Roberta Willis Scholarship Fund, you've had this lag time?
Yes. It's my understanding.
So are there other encumbrances that happen with you distributing the Roberta Willis Fund? And we're giving you the opportunity to.
No, I don't believe so. In fact, I think that, you know, we'll learn the impact of this new federal regulation and work with higher ed and with you folks as well as to what the best processes will be. Again, we'll work with the governor's office, OPM, and legislature to figure out what is the optimum way to resource this money and distribute it. And that's, that's my best answer for you. And I'll endeavor to have Mark write specifically back to you and give you a history of how that's allocated.
So I'm just giving you a flag from me, but probably from many of our legislators. As they've gone and talked to their community colleges, they've said that they've had a problem too. So this is not just one voice, this is multiple voices. And when we have multiple voices, maybe it's up to us to make sure we connect with you. But if you are the keeper of the money for college, the kids need the money in the beginning to know how much money they have to go and hustle for in order to make that goalpost.
Completely agree.
So if we have this continuum, we're going to continually have a struggle with them. So I'm not going to, I'll stop with
The
that.
message has been received.
Thank you. I know, I
Representative.
stopped. So then I looked at the racial and ethnicity breakdowns that I got from your department. And it's very hard to figure out who is actually, it looks very evenly distributed, but they have this one category that's huge. And that is NA. NA has 5,000 people in it, but American Indian has 250, Asian has 374, African American has 257. The racial information that we've got for the Roberta Wills, I don't
Okay.
think I'd like to know, is this information self-report, or is it an addendum to the grant, so that that's not part of what has to be applied for those
It's self-reported.
demographics?
Ram, you want to
Okay,
come up
but
and?
Are those are the demographics of who the person is that is applying doesn't get specific.
It's my understanding it's a self-reporting process.
Okay. Okay, because it's hard for us to figure out who are we working with and who is providing us, getting the actual use of the dollars. So
Sure.
we need to have better data, and if necessary, we'll talk about it in the subcommittee. But for us to serve the kids and the adults that are out there that want to go to school, we got to know who they are and who's the participant in that. So
Sure, and we're glad to work with you on any opportunity that we can.
all right.
I'm delighted to say that this new software system will actually hopefully provide us,
Okay.
better reporting, easier ways to transact with you.
All right. I'm being yelled at. I need to shut up by my co-chair.
All set,
Yeah, sure.
Madam
I'm sure
Co-Chair.
there'll be follow-up.
Representative Nuccio.
Thank you, Madam Chair. And thank you for coming. I am a product of community college in this state. Two of my children went to community college before going on and getting their bachelor's elsewhere and such. I'm a big advocate for the community college role here. So I'm curious when I'm looking at especially the Board of Regents piece, of something that I'm going to want to focus on, I know in our probably best opportunity for our subcommittee meetings, is how the community college tract is meeting the needs that we have for workforce development. I know there's been a big push for manufacturing, but I think if there's one thing that has been absolutely definitive that's come out of the whole COVID pandemic, is our lack of healthcare professionals, especially RNs. My middle daughter, is a proud graduate of Northwestern Community College. She drove 1 hour and 15 minutes every single day to Northwestern Community College because it is rated as one of the top 5, I believe, nursing programs in the Northeast. But I'm reading through everything that you've had here, and I'm wondering what kind of expansion you're looking to do to meet the needs, to kind of transition from community college providing associate's degrees that are feeders to the 4 years, and using our community colleges to actually become places where people can go. With Northwestern, it's an accelerated 18-month nursing degree. Part of the mystique is, I think that, Kathy's making noises at me. Well, I know, but I figure, just as going forward, like, it's just, I think we're seeing a decline in college attendance across the board with the exception of UConn. And I think we need to see some kind of pivot. And I'm wondering I don't really necessarily see that in the budget here. So it's something that I'm definitely going to want to be focusing on going forward.
Thank you for that question. So our office is responsible for the approval of the occupational school category and essentially some oversight with the independent colleges. So that's Yale University down to Goodwin University. The purview of the community colleges falls with the Board of Regents and the college university system, the 4 universities and the 12 community colleges. I'm not really, I'm in full agreement with you with your statement and what you're looking to get to. And I think we're all trying to do that. My office, frankly, just does not have any purview over the community college system, if you will. That question is better served by when the public university system comes before you for their testimony.
So your office doesn't have anything. So you said the occupational piece of it, I would consider, is nursing not considered?
So when I
occupational?
say occupational schools, think about New England Tractor Training, Porter and Chester Institute, Lincoln Tech. We have about 25 different cosmetology schools that teach you how to cut hair and
Yep.
put beauty products on. So
Forgive me,
that sort of
yeah,
thing.
The question's more appropriate for Board of Regents.
Correct.
Thank you.
But I thank you for the question, though.
Thank you. Are you all set, Representative?
Yeah.
Okay, up next is Senator Slapp.
Thank you, Madam Chair. Good to see you. Just a couple quick questions here. I'll ask kind of both of them and then you can
Sure.
take them at your leisure. So the first, I just want to go back to the Roberta Willis Scholarship. And I know as, the Senate Chair of the Higher Education Committee and my colleague and co-chair here is here, Representative Haddad. I mean, we're going to have a kind of more comprehensive conversation about that, but there's many of us who want to increase funding for the Roberta Willis Scholarship, and I'm very heartened to see that the governor has proposed that as well. And at the same time, we hear that, well, not all the money got out the door, right? And so if you could just kind of explain that a little bit further, knowing that, I mean, I know we'll have more conversations, but I think it's important for this body to kind of to hear that too, because we want to, many of us want to increase funding for that program. And we want to ensure, right, that it gets out to the students who need it in the most efficient way possible. And we're hearing that there's bottlenecks. You addressed some of that, and I'm just kind of want to build on what Representative Walker was asking.
Well,
about.
if you could help me out with where you're hearing the bottlenecks are coming, my only recognized situations have been when we go back and audit a college and they return funds, we actually put that back into program funds and redistribute those dollars where we can.
Yeah.
So it would be helpful to me to learn where that bottleneck is, and then, we can certainly address that. To the extent that, again, we're a compliance office and we're a distribution sort of center, if you will. We feel comfortable with the technology that we now have that can expedite this. And we also feel that we can help you make decisions on how to best distribute those funds. The amount of Roberta Willis money has not changed since I've been here, but for ARPA funding, which has been included, and most recently in the governor's budget, a commitment of an additional $4 million. There's a program study that's underway, and I think we'll be working with higher ed, your offices, if you will, to really help you figure out how best you want to distribute, additional money and where it ultimately should end up. I'm not a policy maker. I don't make decisions on who gets what. We follow the form.
Right. We're trying to
it's
quote unquote fix, right? I think
right.
formula
And
that
so,
needs some tweaking. I just want to ensure that and I know President Chang is here, and we have people from Board of Regents and oversee the community colleges, and we ask them that there's not a, talk to OHE kind of thing, that we just understand fully where the bottleneck is. And if you have any insight into that, I mean, whether it is at the community colleges, in part because there's additional funding from ARPA that there has been, right? Maybe that's it. Go ahead. I didn't mean to cut you off.
Well, I guess it's just, we've heard from UConn, we've heard from the university system, we've heard from the independents on their thoughts on how they best feel that they can take advantage of these dollars. And we basically regurgitate the same thing I'm telling you. We are not policymakers. We can help you, decide where, based on where money has gone in the past.
Right.
But
So
I mean, if
are you seeing a
statutorily,
bottleneck? Are you seeing that there's Roberta
I'm
Willis?
not
money
aware of a bottleneck.
that's
There
not
may
getting
be
to the students?
instances where money has been returned and not reallocated. But if you can identify that, I can pinpoint what's going on specifically.
Okay. And I'll, kind of follow up with your office, and I appreciate that. I know
Please.
you're committed to continuing that conversation. My other question is about oversight with the private occupationals. And, we just saw, I imagine you kind of alluded to one of your staff members is dealing with one, I think it was Stone Academy
Correct.
that's has kind of blown up just now in the newspapers and in the media. We're hearing about that they're going to be closing campuses, et cetera. And I do have concerns, obviously. I think we probably all do about, what students there are going to be doing. Do you have adequate resources to, provide? I know you do currently provide some kind of oversight, and there's accountability with entities like Stone when it comes to student default ratios and on student loans. I mean, do you have the resources to make sure that there's not more Stone Academies?
So the Stone Academy situation briefly is, we have the approval for that, for those types of schools. And there's 830 students that are, as of Monday, don't have a place to go. So we are going to endeavor to do an audit. We currently don't have resources. We're working with OPM to, we're deciding who's going to pay for this audit, Stone or us. And so we will do an audit, figure out what the baseline is for each and every one of these students so that they have a clear path forward on what their transcripts look like and what their refund options look like. To answer your question specifically, I think we have adequate staff, and where we don't, we contract for that. And I think that that's probably the best way to do it. Understand, of course, that in this particular situation with any type of nursing operation, we work hand in hand with the Department of Public Health and the Board of Nursing. So as it relates to this situation with Stone, much of what has been decided and brought out was through the Department of Public Health and the Nursing Board. When we did their renewal application, we did our investigation, and this is what was determined during that investigation. And so we have the ability to survey. Once we have this audit conducted, and we're going to try to do this as fast as we possibly can, we'll get to the bottom line for these students and provide a remedy for them. Some of them, quite frankly, will ask for their money back and find a new opportunity. It's our intent. We're working with Lincoln Tech, who is another Connecticut school, to effectively teach out those that are close to graduating into an opportunity to get that LPN certification. We've done sort of a dive into it, and over the last, but for the 22 cohort, there's approximately 275 students that would be the first in, first out. And the 2022 cohort is about 500 students. So every individual student has their own story. It's our intent to listen to every individual student and do whatever we level best can to support them and give them accurate information so they have a path forward. So the short answer to your question is, I believe we are properly staffed, and this is a for instance where we need a little bit more support, and we'll find it, but this isn't an everyday occurrence, and it does have a magnitude. So we'll get to it. Everybody in my office is working on this.
Yeah, no, thank you for that answer. And I mean, I think this is part of the reason there's some folks, myself included, who have concerns about the Roberta Willis Scholarship, as an example, being funneled into private for-profit occupational schools, right? Because these type of things happen. I'd rather see us build up resources at our CSCU system. But anyway, and let's have them pay for the audit. But anyway.
I would love that. And I would just to your point about staffing, we have been working with the Office of the Attorney General. The Office of the Attorney General also has our attorney, Dan Shapiro, and his team also have worked with the Department of Public Health. So the AG that is assigned to our office is the same AG that's assigned to the Department of Public Health. So there's continuity between agencies. And I can't thank them enough. I can't thank our staff enough. I can't thank Noelle Kidney enough. She's been extremely instrumental in the back and forth with all of what has been going on and all of our contact with the media, including the governor's office, et cetera. So it's an effort that we're putting all hands on deck on, and we will make sure that to the level we can, that every student has been touched and has been counseled on what their options are.
Thank you very much. Thank you, Madam Chair.
So based on that, I just have one question. Senator Slapp said that he doesn't want to see Roberta Willis going to private for-profit. I thought that you'd said earlier that Roberta Willis does not go to private for-profit, just goes to.
It does not go to Post, which is our only school.
Does it go to any private for-profit organization?
No,
That's what I'm trying to make sure that we're all, it only goes to public and private, not-for-profit organizations.
that's correct.
Okay, I
Connecticut
just wanted to
students
make
going to
sure,
those
'cause
schools. That's correct.
unless I misunderstood the question, I just wanted to make sure that that
No,
was accurate.
Madam Chair, there are proposals this legislative session to change that. So that's what I was addressing.
Okay, thank you. I just want to make sure that they weren't going there because I'd asked that question before that, and I just wanted to make sure that we were all on the same page. Up next is Representative Paris. You had your hand up earlier. You're online. Are you interested in speaking?
Thank you, Madam Chair. I wanted to ask the commissioner a question around around the metrics and also the process in which students find out about whether or not they are eligible for Roberta Willis dollars. I've been hearing from students at state institutions and at institutions across the state, many of whom would obviously qualify for the Roberta Willis dollars, that they've never heard about the program and therefore aren't able to get into the system to help offset some of the costs of their college. So I just wanted to understand a little bit more about that process and how it can maybe be better streamlined should there be a larger appropriation given to the program to help support more students moving forward. Thank you.
Sure. Thank you for that question. As part of the Roberta Willis allocation, there's approximately $100,000 worth of administrative money. Last session, you appropriated some additional money so that we could fund the software application support for this. So of that admin money that we use that to effectively hire an auditor that will go back into the individual schools and make sure that all of that money is going in the right places. So we don't really use any of that admin money to pay for in-house staff. That's all. It all goes back into the program. And if we have any admin money back, it goes back into the program. We use every penny. And the intent is to provide as much as we possibly can. We have no marketing material or budget to announce that this is available. Frankly, it just has been more important to us to do this. This information should be readily available at every high school and every institution where people are actually applying for college. And we're looking for, that resource to be our mouthpiece as well. Each of the colleges have an obligation, I believe, when they interview their incoming students to make sure that they in fact are aware of state resources that are available continually. This is not a new program. It has been around for a while. And from the input we have gotten over the last several years from all college strategies is that they're all very interested in this resource to help students out.
I appreciate you answering that question. Thank you, Madam Chair.
Thank you, Representative. And just a quick note that if we need more information, we can ask for them to bring it to the subcommittee. So,
Absolutely.
that way we don't have to get all the answers right now. Representative Dathan.
Thank you so much, Madam Chair, and thank you for your presentation this morning. Just wanted to kind of get, I know we've talked a lot about the Roberta Willis scholarships, but I noticed in the ARPA funds that were used, 15 million went towards the scholarships of Roberta Willis, which I'm guessing is about 333 students were able to access additional scholarships. Am I understanding that correctly, or are those students not going to be able to receive scholarship going forward? Because outside of the additional $4 million that the governor's requested, the scholarship seems to be very level funded.
Yeah, thank you for that question. So I want to give you an accurate display of how all of that program money is being spent. So I would request that I would have Mark French get back to you with a complete list and run out of that money so that you can see where it has gone to, what schools it has gotten to. And clearly this is new money that we're putting in. And if, you know, if you continue to put money in, we'll continue to distribute. If that money goes away, we won't have it to distribute and so forth. So we're trying to use everything that we can as effectively as we can. And I'll endeavor to have Mark get back to you this afternoon, if not sooner, with that answer.
Thank you so much. My next question also around the ARPA funding. The other 28 million that the agency received, netting out the scholarship funds, how was that used? And is there going to be difficulty in the next biennium by not having those funds? And do we have any sort of risk of any of the other sort of programs that you all operate?
So our office effectively has been, I'll use, for the lack of a better term, a distribution point. And so as programs have come up, we've used our facility to, because we do touch all of these colleges and universities, and where we can help distribute funds through our networks, that's where we have done that. So there's not any real new programming out of our office. Jackie, am I accurate with that?
That's correct.
Yeah, so we can, again, provide you with the information on how all of that, the distribution of all those ARPA dollars are through our agency. For the lack of a better word, we're a pass-through agency and an auditing agency to make sure that they're handled correctly and that funds are going to the right places.
Got it.
And we
So-
rely on the institutions as well to provide the implementation and the accounting for all of those dollars that we send out.
Okay, thank you. I know
Great.
because some of the other agencies within, like UConn has also received ARPA dollars. So I'm just kind of curious. Just want to make sure we don't run into issues. Madam Chair, may I ask one more question? Okay, thank you.
Nope. Representative Hoxa. Did you have a question, sir? Okay, thank you. Are there any other questions right now? We're going to take things to the subcommittee. Please bring your additional questions to the subcommittee. We're over our time frame for the Office of Higher Education.
Just ask them brief?
Yes, you may.
So could we get you like a spreadsheet sort of following up with what we've got with carry forward dollars and ARPA dollars?
Absolutely.
And lapse dollars? Do you do, did I hear you say like you basically claw back the money? If they don't use it, it gets clawed back?
I don't know that it's clawed back.
Okay,
I
well,
think
then
it's sent
you will
back to
provide-
us.
you
You know,
will-
if Southern Connecticut gets an allocation, I'm just, for example,
Yeah.
they're not able to use $4,000 of Roberta Willis money. We do an audit, that money gets sent back, put
Okay,
back into, and then gets
so
redistributed.
Wherever the breakdown, we'd like to see the breakdown of
Absolutely.
where all the money goes and to whom.
And ARPA, sure.
Yes. Well, no, in the Roberta Willis Scholarship Fund.
Okay,
Okay,
yep.
thank you. Yeah, that's going to include ARPA.
We
but-
will give you two. We'll give you the Roberta Willis breakdown on ARPA and then the other distribution of ARPA funds. Correct?
The ARPA funds are in a Roberta Willis. Well, okay, yes,
There
fine, that's
there
fine.
may have been other program money other than Roberta Willis that we've distributed for ARPA. So we'll make sure that you get that.
Awesome, thank you.
Thank you very much.
you.
Executive Director Lawrence.
Always delightful to be in your company.
Delightful to see you, sir. We're going to go right into the Connecticut State Colleges and Universities, and we have President Chang that is going to present, and he has got his team with him. I know you did.
We work together.
Mr. President, the floor is yours.
Good morning. We're very happy to be in front of the Appropriations Committee today. I have a few brief remarks. Thank you for the time. With me today is Ben Barnes, our Vice President for Finance and Administration for the system. You also see behind me presidents and CEOs of our campuses who are with us. And I believe we also have faculty, staff, and union leaders from across our system who are in attendance or in the building today with us as well. We appreciate their time. Just briefly, before we begin to answer questions, I want to thank the committee for allowing our students to be able to testify online later this afternoon and this evening. Without that possibility, they wouldn't be able to do it. Many of them would not be able to come in person because they have personal and professional obligations. So we appreciate that. So that being said, we are open to your questions.
Thank you. So I'm just going to go to the position count first. How many open positions do you have that are unfilled authorized positions?
Ben, do you have an estimate on that?
Yes, just recently provided to me. We currently have all of the elements of our system have been taking attrition in preparation for an uncertain future. And so we have held several hundred positions open across the system. I will be able to provide you with a detailed number of those positions that have been held open and are not currently being refilled, awaiting action on a budget for next year, as well as those that are currently under recruitment. I don't have the total now. I want to make sure I get it.
Just
right.
bring it to, if
I'll
they,
bring it to subcommittee.
that would be great. Bring it to the subcommittee. And you haven't laid anybody off when you're talking about attrition. What you're talking about is those who have left for whatever reason, retirement or whatever, and have not been hired, or have you laid people off? It's probably the better question to ask.
Over the last year, we have laid off several people, but not, if those have been related to specific organizational matters, and we have not laid off any bargaining unit members during my tenure over the last 4 years. But there have been a few individual managers based on organizational needs of the.
Oh, okay. So mostly in the managerial.
And not very many.
Okay, thank you. Representative Walker.
Thank you and good morning. Good morning, everybody. Good morning.
Morning.
Great to see you. I was down in Joe's territory yesterday, meeting with the kids, and they were, I shouldn't say kids because some were the adults. They were awesome. They were absolutely awesome. So you heard my discussion with the Office of Higher Education. Can you tell me in a very brief, your experience with the Roberta Willis Scholarship for your students, especially in the community college area?
I'll be brief. We believe that the Roberta Willis Scholarship funding is incredibly important. At the time, the way it is administered through the current policies and regulations, they are quite stringent, and thus they are not able to get to the students at a time when they can make the decisions in terms of whether or not higher education is going to be important for them. So the timing is really critical. And we also believe that some of the framing around Roberta Willis is also preventing some of our students to qualify. There are many students in our system with great need, and ultimately the way things are apportioned, it's just not reaching as many students as we believe it should. I don't know, Ben, if you want to add anything to that.
The only addition is that the uses of the funds don't allow us to pay beyond the tuition fees, generally speaking, because especially in the community college context, we have such a large share of our students who have resources through Pell or through the PAC program and other institutional aid that they can't be awarded a Roberta Willis grant because that would exceed their total tuition and fees. However, we all believe that it it is appropriate and helpful for us to provide aid beyond tuition and fees to help the students cover the cost of attendance. We would love to be able to do that more flexibly within the Roberta Willis program.
Okay, so what I would ask that you would bring to our working group is your recommendations for the CSU and the community college system, what the encumbrances are, and we can work together, because you've heard that it's a very important method of funding higher education, and we don't want to reduce it or eliminate it, but we want to make sure that we are equitably distributing those. So it would be helpful if you give us just the breakdowns in that.
Absolutely.
Where do we go? So the the recommendation from the governor, we all saw. And I'll be honest, what I did was I went out and I even called several of your members, and I called some other members in higher ed to ask, outside of Connecticut, to ask how are other states addressing this reduction in staffing or in students, and not allowing that to impact access to the students. I know that that's a long one, and I don't want to be occupying it, but I would like to have that conversation. And I'd like to have some of your ideas. I did talk to a couple of presidents of colleges yesterday, and they said that what they were happy about right now was they were having smaller classrooms. And it was giving a little bit more attention to many of the students, but the states, one was in Chicago, that's not a state, Illinois, and the other was in New York. And both of them were saying that they were trying very hard to keep their money, but they were coming up with different methods of how they were going to do it. So I give you that challenge and how we can have an idea of what we can do to address that, and how we can manage to get through this tunnel that we've got, because I understand the problems with the pensions and everything. But we also don't want to cut off one area for the sake of another. So if you have responses now, that would be fine, but again, short. If not, we can take it up in the subcommittee.
Absolutely. It's a great question. And I think that, ultimately enrollment is the lifeblood of any of our institutions. I think it's important to note that the enrollment challenge is not only for CSCU, it is not only for the state of Connecticut. It is actually a national situation right now, and it is particularly acute in the Northeast and in New England. All of the rates are against us: the birth rate, the fertility rate, the immigration rate, the migration rates. They are all working against us at this time. These are things that are unfortunately outside of our control. I have to note that although the legislature has been very generous to our system in the past few years, especially without you all and your support, we would not have been able to get through the COVID pandemic. Be that as it may, in our analysis, it's clear that our operating budget going back to 2007 has essentially been flat due to the fact that the increases to our budget have all gone to rising fringe benefit costs, and that's driven also by our unfunded pension liability. So really, our operating budgets going back to 2007 have been flat, and they've actually been compressed because of COVID and because because of CBAC agreements and also because of inflation. So those pressures have really compressed and strained the budgets even more. I bring this up because it's important. Our system, with a flat operating budget for 15 years, has not been able to invest in the academic programs and the student supports and the infrastructure that our students and our state truly need and deserve. And I don't think there's any other way to elucidate that point. This morning, there was an article in the Chronicle of Higher Education. It is about the difference between flagship funding versus public regional funding. There's an enormous national disparity that continues to grow, especially post-pandemic. And it's something that we have to soberly and honestly deal with if we are going to have a vibrant and productive public regional higher education system. To quote the article, it says, "How are we supposed to attract students to hollowed out institutions?" And that's what it feels like. Our students, our faculty, our staff have been asked to do more with less for at least 15 years, and that is an enormous challenge. But to get to your point about enrollment, What are we going to do? The CSCU 2030 plan that we have proposed is going to be very progressive in its approach to enrollment. There are 4 parts to that. One is to work very closely with the State Department of Education, dual degree, early college programs, academies, more pathways that get their students to become our students, more wraparound services that serve the whole student. As we said before, if we can loosen up Roberta Willis so that it ultimately serves other needs, our students don't stop out because they're not intelligent. They don't stop out because they're not capable. They stop out because socioeconomically and personally, there are so many reasons that stop them from pursuing the pathways that they really should be pursuing and they want and need to. So those wraparound services will increase retention. We're going to focus on new markets, new modalities, more online, more hybrid, more workforce development related programs. And last and related to that is working with employers, talking to folks like Hartford Healthcare, talking to folks like Accenture. What are their needs? Let us align our programs with the needs of the 21st century industry. I hope that was succinct enough. There's a lot there that I think we could talk about for a long time.
Thank you. I went this morning to a program in New Haven at Common Ground Charter School, and they got a scholarship, or not a scholarship, they won a grant from SDE for a unique pilot program that a student wrote. And this pilot program was a pilot program with Southern Connecticut State University. And it was to help them start their basic courses so that they can go right into credit bearing in the areas of study. And this was written by a student. I'm talking about a 17-year-old girl who is now at Southern in the nursing program. But that just shows me that we have a lot of untouched territories that we can do. Things like that, doing pilots with almost all of these high schools that you have, because the day before I was at Southern talking to students. And when I talked to the students at Southern, the beauty was every single one of them was from Connecticut.
Mhm.
Every single one of them. And I was in a room of about 65 kids on one time and about 70 on another. And they all are our products. So I'll end that. Thank you, sir.
Thank you.
Thank you. Representative Nuccio, followed by Representative Haddad.
Thank you, Madam Chair, and thank you for coming. You mentioned a few things there that I think kind of tickled questions for me. One was the mention specifically to the CBAC pressure. Are you under the impression that if you were not under CBAC, that you would have, it would be more favorable?
The CBAC agreements, and I want to make sure I'm clear before I speak about this. We firmly believe that our employees, faculty, staff, administrators need to be paid fairly and appropriately. They do the hard and noble work every single day for our students, for our communities, for our institutions. And so my comments about CBAC and the inflationary pressures are not in any way a reflection of our feelings about the great work that our folks do. That being said, the CBAC pressures are real. Our contractual obligations are certainly real. And if the funding is not there for agreements that were agreed to by the state on our behalf, then it puts us at a significant disadvantage. I don't know, Ben, if you want to add to that. Your microphone.
Yes, we're concerned that the cost of the CBAC agreement, which amount to about in fiscal 24, we estimate that the cost of the CBAC agreement will add about $49 million to the operations of the universities and about $36 million to the operations of the colleges. And that the amount of funding that the governor has provided in his current services proposal for us is well short of that. The governor's proposed of the 49 million, for instance, that we've anticipated new costs at the universities. The governor's budget includes $19 million. So the remaining $30 million amounts to a 21% tuition and fee increase. It's a similar 20% shortfall in the, or a similar 20% increase in community college tuition would also need to be implemented in order for students to pick up the share of the CBAC costs that the state has not, the governor's budget does not include.
So I guess that's where I get confused. You're saying that you support the CBAC agreements, but it's negotiated on your behalf. And I guess I struggle with the idea that these raises for professors and such should not be baked in as part of the operating cost of tuition. So is the assumption that because you're not at the CBAC table, that it should be the taxpayers that should fund that entire increase?
Well, no, I don't think that that's the point at all. I believe that our argument is that historically, the state has provided an increase in block grant to reflect a significant share of the cost of collective bargaining agreements. Because in many cases, the state generally pays for a significant share of the operations of our systems. It's higher in the community colleges and a little lower in the universities. And because the share of the increased costs that is being offered in the governor's budget is below what we normally would have seen, it's less than half. They propose covering about a third of the costs of the new collective bargaining agreement. That means that the other 2/3 must be covered by students. We only have two basic sources of revenue, the state's general fund appropriations and operating revenue from student tuition and fees. So by making students pay for approximately 2/3 the cost of that, we will have to significantly expand tuition and fees, or else reduce our program offerings and cut expenses in ways that we believe would harm students' opportunities, access, et cetera. So it's just a matter of how we pay for those agreements.
That kind of gets me to my next question. I've been looking at the enrollment, as you mentioned, and there is nothing in sight that says enrollment is going to tick back up to what it was 10 years anytime soon. So with that though, and looking at your subsequent budgets, we don't see a correlation of down, like any kind of right sizing, I guess you would say. And I understand the plan that you have is to make the systems more attractive in that, but you're still fighting for the same amount of people, right? So I guess I'm wondering, what are the schools doing to change your plans and right size the university for the amount of students and enrollment that you're going to have? And as a kind of a follow-up to that, I think you were in the audience when I mentioned the question about like the nursing school and stuff. I think the universities there are, I read one of them, like 100 and something different degrees offered, or majors majors, et cetera, et cetera. What are we doing to look at universities, and especially the community colleges, filling the role of helping the workforce that we're seeing major shortages in, especially in the nursing area, the healthcare areas and that? How are you pivoting to meet the growing demands of the workforce in doing so through the most economic way for our students, which is the community college route and not the state university? You do not need a 4-year degree to be an RN in this state or in the country. Actually, you do not need it. You do not need to incur that kind of debt. You can do it at a community college in a 2-year degree with virtually no debt, and then finish your online for a 2-year. So how do we see that shift from the mentality of every kid needs to go to college and get a 4-year degree, in contrast to workforce demand?
So I hear two primary pieces to this. One is about how are we gaining efficiencies in our operations, and the other piece is about how are we meeting workforce demand, with the example specifically being in healthcare. So I'm happy to tell you that we work very closely with the Office of Workforce Strategies. We are the lead partner in executing the CT Health Horizons program. And so that so far has been moving along very well. We have also worked very closely with the Governor's Workforce Council in prioritizing healthcare programs, especially at our community colleges, but across all of our institutions where we have healthcare and nursing programs, knowing that it is a need for the state and it's not going anywhere anytime soon. We actually just had a professional development trip with one of our lead partners at Hartford Healthcare, understanding how we can work better and more closely together, be more innovative and push things. But there are multiple opportunities. Our nursing programs at our community colleges, especially, I believe, are at this point oversubscribed. You know, it's not about necessarily the demand. I think we have to do a better job of also aligning the clinical components of that educational experience. And that oftentimes is just about finding more opportunities with our healthcare partners. And that's why we are trying to work very closely with Hartford Healthcare and be entrepreneurial and innovative about how we create more and more of those types of opportunities. In terms of the economics, we completely agree with you that we are by far the most accessible and most affordable, high quality experience that will get individuals into the workforce as quickly as possible, especially in key areas such as healthcare. And so we're going to continue to push to create new programs, new credentials that will get folks into the market as quickly as possible to fill those needs. But again, I'll come back to the fact that with compressed and strained budgets over 15 years, it's hard to get those programs up and running. You know, we are an infrastructure that is built in a 20th century paradigm of higher education. And for us to meet 21st century needs, we have to have a 21st century investment to get us to that point. You know, we strongly believe in that. In terms of efficiency and right sizing, I will tell you that since I've been in this position for over 18 months now, we've made it very clear with all the presidents and all the CEOs that we are looking to make sure that our resources are allocated appropriately, that there has to be a tangible return, there have to be metrics, and there has to be accountability in how we spend the state's dollar. We take that very seriously. In subcommittee, I would recommend that we can bring to you a list of the efficiencies that we have gained, and we can break that down by institution. But I'll tell you that we've been very aggressive. These are not easy conversations. They're challenging conversations. These are hard decisions, but we take it very seriously. We know we have to do that, or else we are not going to find the right balance. I'll also say that it is not realistic, and it is not one of our goals to try to return to the enrollment levels of 2010. That was the apex, but the demographic shifts of the country point us in different directions. So now we have to stabilize and then ultimately build off of a new foundation from there.
I would agree. And while I heard what my colleagues are saying, you know, I would say if we have a college class that has 6 kids in it, you need to consolidate that into.
I
Yeah.
concur.
That's the end, you know, we have to start looking at philosophically, what is the intent of our college system? And how does that facilitate our students getting out of college with the least amount of debt and the highest opportunity for a job that's going to make them sustainable? So I would ask that, yes, if you can bring those statistics for the subcommittee meeting, I would really appreciate it.
We certainly will, and we're definitely aligned with you in that thinking.
All set? Representative Haddad, followed by Representative Dathan.
Thank you, Madam Chair. And thank you very much, President Chang, for your presentation this morning and for being here to answer questions. We appreciate your time. We are short of time, and so I'll just hop into a couple of questions. But first, let me just say, you know, I mean, certainly I think that, you know, we know that our private colleges are great institutions in the state of Connecticut. UConn, our flagship university, is a great institution. And we have a great system of community colleges and state universities. And it takes all of them to meet the demands of our constituents who want to get degrees and to be successful in life. And in fact, we're hearing increasingly from employers that one of their primary concerns is whether or not there's a skilled workforce in Connecticut that will allow them to grow. And so we need all of these systems to work well and to be well supported. And so as we struggle with the governor's proposal, which I think does not provide enough, we need to be mindful of that so that we can get you enough to do what you need to do, right? So and I appreciate the previous soliloquy. You probably said that better than I did just now, but I just wanted to say that I agree. My question actually is around the governor's proposal over the fringe support and how he wants to deal with the fringe support. I looked at your slide on page 10, which, you know, shows that, you know, essentially the operating support, the amount that we've been providing to the state university and colleges over time has fluctuated a little bit, but has remained largely steady for a decade or more. And that, you know, anything that might be described as state assistance is really been consumed by an increase in what is called the fringe rate, but really should be appropriately called the legacy costs, long-term, you know, pension obligation of the state of Connecticut. That, you know, my understanding is that even when you look at the fringe rate, you see a lot of professors out here, their benefits are not getting better over the last 10 years. They are the same, and maybe even worse, given the, you know, the steps through CBAC 1 and 2 and 3 and tiers. We're up to what, 4 or 5 or something like that now. And each step of the way, we've, you know, worked to control the normal cost for employees, and so we know the increase isn't there either. Where it is what we expect it's our payments into our long-term pension liability. And so your chart here, I think like all of the growth that's shown in what you call state support, most of the support, I won't say all of it, I'll say like almost all of this increase in the state assistance to the system, to private, public colleges and universities, has gone to pay off long-term pension obligations that were incurred long before the students were born, right? That's one thing. So my question though, with the governor's proposal, there's a lot of moving parts, and I'm trying to sort it out. From the perspective of a student who's paying tuition into your system, are they likely to realize any relief from the burden that's been placed on their backs already to pay for long-term legacy costs as a result of the governor's proposal and the shift that he makes in the way that long-term liabilities and pensions will be paid for? And I see former Secretary Barnes, your chief finance, probably uniquely qualified to answer this question, having served on both sides of the coin. But that's my question.
Yeah, I think you can feel Ben vibrating to answer this one. So yes.
The answer is no. The governor's proposal on its face is that the changing of the responsibilities for different parts of our fringe benefits would be revenue and cost neutral to the institutions at the moment that it was executed. We're still evaluating. We're developing a pretty sophisticated effort to project what our fringe benefit costs would be under the existing and under the proposed methods through the biennium, which is technically challenging, but we're working through that so that if the legislature goes forward with that proposal, we can help ensure that it is neutral in its at the moment of its implementation. We do have some concerns though, and this would ultimately impact students and affordability, that the portion of the fringe benefits that the governor is proposing to have the students pay is the portion that includes employee health benefits. And employee health benefits, while the state has done a good job in trying to control the growth of our health benefits costs, and during the pandemic, it's been up and down. Over time, health benefits costs in this country do seem to rise at a very aggressive pace. And so we're concerned that we're left with a part of this that's going to grow by 10 or 12% a year, whereas the portion that pays for unfunded liability at this stage, that should only go up if there is cataclysmic results in the markets and the value of our pension investments goes down for some reason. But otherwise, they're already putting $1.7 billion into unfunded liability. They have for a couple of years, and their current plan is to continue doing that through the amortization period. I don't see the unfunded liability portion growing as quickly as the health benefits portion. And so we're a little concerned that by leaving the health benefits portion on the backs of students, we expose them to cost increases in the future. But we're happy to continue discussing that. We understand that there's a lot of value to the governor's proposal. Certainly our colleagues at UConn have a great deal of investment in that because of its impact on their research activities.
Just as a follow-up to that question, I'm sorry, President Chang, did you have anything that you wanted to add to? I see your microphone. So just let me ask a follow-up question. The follow-up question is, if as we just reestablished our fiscal guardrails as a state, right? So when we have an unexpectedly large surplus, we are paying down our long-term pension liability with a significant part of that surplus, and that's, I think, the appropriate thing for us to do. That means that that will in fact reduce, has a potential of reducing the annual payments into our long-term pension liability. But it's safe to say that when we make early payments, if we were to adopt the governor's proposal, when we make early payments to our long-term pension obligation, that the benefit of paying down those obligations more quickly at this point won't be translated to students. That'll be retained by the state, but it won't be translated to students in the term of, because they won't be paying that obligation anymore. They'll be paying for the loss of block grant revenue instead. So unless the block grant were to be altered by a similar amount, then that any early payments don't accrue to the benefit of students.
That's correct. Yeah,
Right.
that's right.
And then just the last thing, and this is something I'd like to ask you to bring to the subcommittee. I'd like to see, over time, your chart talks about the state support to the system. What it doesn't also map out for us is how your payments through your revenue streams for your employees that are non-block granted employees, how your payments have increased to the comptroller's office. You have to pay the comptroller's office for the benefits for the non-block granted employees, right? I'd like to see over a course of 10 or, I guess you go back to 2007 in your chart here. I'd like to see at least 10 years, maybe more, of what those payments look like from your system to the comptroller's office for what you're asking, what you've been asked to pay for fringe costs, including long-term pension liability, using tuition revenues.
We'll certainly provide that. Thank
Yeah,
you.
we can
Thank
find-
you.
So we're not gonna call on Representative Dathan. Senator Flexer has some constituents here, and so she is gonna go next. Senator Flexer.
Thank you, Madam Chair. Good afternoon. Thank you both for being here. Thank you all for being here. I'll be really brief. You run wonderful institutions that I think are so critical to the future of our state and today in our state. And I'm disappointed that we're here contemplating a budget that, in my opinion, disinvests in you so much. And so I have a quick clarifying question that you can bring more details perhaps to the subcommittee. But in your presentation on pages 11 and 12, I'd just like to understand the difference in these numbers. It looks to me like this is $170 million distinction between what you suggested would be necessary to run our community colleges, Charter Oak, and our state universities, and what the governor's proposed. Is that what this these sheets show?
Thank you for the question. So to clarify, the differential that we are, looking at here is between the governor's proposed budget and the CSCU 2030 proposal, which we believe is the best path forward for the system.
And is that a proposal that was presented to the governor's office before his budget was finalized?
Yes, it was.
Thank you.
Senator Olsett. Representative Dathan, followed by Representative Hoxa.
So just to follow on with what the senator was talking about, the 2030 plan, do we have a copy of that here in appropriations? Because I don't remember seeing it in the previous year.
We
If you
certainly,
can bring it to the subcommittee, that would be useful. I mean, I just want to see kind of some of the assumptions behind it
Certainly.
in terms of enrollment, fees and things like that.
should have been distributed to you.
It's in the written
apologies, didn't
testimony, I
receive it.
think.
Oh, okay. Apologies that I missed it. I'll have a dig in. I was really happy to see your analyses on the return on investment for the students. And I actually attribute that return on investment of obviously the quality programming, but also attracting the talent and the teachers. And we need to make sure that we attract the best and the brightest.
Absolutely.
To ensure that we continue to have an ROI and students decide to come to these centers of excellence. And so, I was a bit sort of concerned about some of the discussions about the CBAC, because I do think that is something that is part of it. I'm wondering if you can provide for the subcommittee next time information on your teachers, the sort of attrition rate that you have. You did talk a little bit about other attrition you had overall, but just kind of curious by institution where we're seeing, those, because that's really important. And in terms of the shortfall that you show on slide 13, the differential between the CBAC, do you have that on an institution by institution base?
It's not in this particular presentation, but we can dig in and provide. Is that correct?
Yes, we don't,
Mike?
we don't
Track it.
establish the distribution among, well, first of all, Connecticut State, the community colleges are becoming merging effective July
That's
1st. And so
true.
there's a sort of single amount of money that goes to those. And we would be able to talk about the amount of budget authority that they grant to the individual campuses, although some obviously is for the administration at the center. We can estimate what we believe the impact on the 4 universities is, although we don't finalize the distribution until later in the year once we know the number. But we can provide you with an estimate of its impact on the 4
I guess more of
universities.
my kind of questions is sort of maybe like a trend and where we are with, professors, teachers by institution and where we are with CBAC. I mean, recognizably, CBAC's not only for the teachers, but just kind of trying to get an understanding of how that breaks down, because we need to make sure that we continue to invest in our teachers in the state. And I think CBAC is one of the reasons. And I'm sure you're competitive with other states. It's,
Yes.
we do focus on Connecticut residents, but we don't want our best and brightest going to other states because we've not invested in quality educational services.
Absolutely.
All right.
Well, we can
thank you.
provide that. In general, though, attrition amongst our faculty is lower, has been lower over the last year than it is been amongst our staff, which I am encouraged by. It is a sign that the faculty continues to support and have confidence and comfort in their positions within our institutions.
Okay, fantastic. Thank you so much. Thank you, Madam Chair.
Thank you. Representative Hoxa.
Thank you, Madam Chair. So the question that I have for Mr. Chang and Mr. Barnes is, the general approach here seems to be that if you build it, they will come. And, I sat through one of your presentations a few weeks ago and I was happy to do so. And it seemed like you have, a very, a broad vision for, turning the state college system around. My question is, can you point to an example where, a state school college system has faced, student a decline as big as ours in student enrollment over the, the decade or decades, and has been able to turn things around using this approach of, investing in all the areas that you want to invest in. Some things that may even go, above and beyond this committee. Can you point to an example like that to maybe give us all a little bit of, extra, kind of some hope, to breathe in some hope into, people that may have some doubts?
Absolutely. It's a completely fair question. And I hope it doesn't sound like I'm being cagey or trying to dodge. We're happy to do the research. But I would argue that we are in literally unprecedented waters. We had a black swan event. It is literally once, in a century event with COVID. And that truly exacerbated the already declining enrollment trends of the nation. And so I think we in higher education find ourselves in completely uncharted waters. That said, the approaches that we're talking about with the strategies and tactics that we're talking about, these are absolutely reliable approaches to, if not generating more enrollment immediately, to stabilize, because what we're doing is creating if-then value propositions that people understand. They have to invest their time, they have to invest their money. They want to know that if they engage with our institutions for education and training, that there is a then proposition that leads to a job and a better sustaining, higher wage and sustaining lifestyle. I would say that, we see this as an opportunity. We see this as an opportunity to be leaders. We see this opportunity to create a vision and to create something that has not existed before in the state of Connecticut. And I think it's a chance to really align what we talk about in the state with what we're actually going to do in the state. And in our, I won't call it research, but we've been looking around at what other states are doing. States like New York are investing more money in their public higher education system. States like Rhode Island are proposing to invest more money in their higher education systems, public higher education systems right now. And they are in very similar, if not exactly the same demographic challenges that we're in, but they're actually looking to double down on their public higher education systems. And I think this is a chance for us to not be in misalignment with what we say and what we want to do. We believe that this plan will allow us to do the things that the state wants and needs us to do when it comes to workforce and educating the residents of Connecticut so that they stay and live and work in Connecticut for the long term. But we can provide much more information and much more modeling to help sharpen that conversation, because even as we are creating a vision and we are trying to be bold and audacious and ultimately create a positive, path forward, we realize that there has to be tangibility and reliability in what we're proposing. So we'll provide that in subcommittee for sure.
Well, thank you very much. I look forward to receiving that, research. Yeah, I mean, anything concrete, anything that you could, point to and say, this is the model we're sort of pursuing. Would it be helpful to all of us, I think.
Absolutely.
Thank you.
Thank you. So we're getting towards the end and I have nobody that has a question right now. So I want to talk a little bit about what we need back at the subcommittee reports, just broadly. Relative to debt-free community college, how much money you got in and how much money went out the door for that debt-free community college, and what your best estimate would be if we expand debt-free into returning students, both full and part-time, in the community college level, no matter where that returning student came from.
Yes.
And as long as they're Connecticut residents.
Correct.
I got a little bit confused when I think it was Senator Flexer said it was $170 million. I have down on the two numbers that you had, agency requested 487 and the governor put in 414. That's $73 million difference, give or take. And then 497 in fiscal 25 and 423. That's 74. That's $147 million. So I just want to know what the difference is between this plan and the plan that you have in another sheet so that I can see what that is. So if you could bring that to the subcommittee also.
Certainly.
And then you're bringing back the position counts and how many positions you have open. And if we could get that by facility, I understand that community colleges is all going to be one, but you must know how many people are in each one of the 12 community colleges in each one of the state universities. Madam Co-Chair, did you have any other questions that you wanted to bring to the subcommittee?
Yes, I'm going to make it short. On the guided pathways, can you give us some information on how we're doing with it right now? And what's your expectation on that for the money that's involved in that? And there was one other thing that I had. No, the guided pathways was really the only other one that I really need.
Great.
Okay.
Guided pathways.
We really appreciate you coming today. Thank you very much. The Appropriations Committee is going to recess until the University of Connecticut at 1:30.
Thank you
Yep.
so much for your time.
Thank you.
Thank you.
Yeah, they are. We always get your testimony online. They get all of it. Here.
I don't know about that. That's not acceptable.
Nice job.
Gonna have to work on that, buddy.
Hello? Yeah, it works.
What's up?
Pass Bill 225.
That's it? Oh, yeah. We can talk.
Hello? Save UConn. Over. When higher education is under attack, what do? We stand up and we fight back, period. You're going to fund our future. We are your future lawyers. We're your future doctors. We're your future social workers. We're your future, period. So pass Bill 225.
What is UConn here to do? To build. But they want our funding down. They want our class. Can you build anything down? You cannot.
Hello. Garrett. Why are you here?
Just trying to do my civic duty.
Actor moment. That's me.
So good afternoon, everybody. So all of you that are taking pictures, if you could,
This administrator
Yeah.
said, wait.
thank you. All of you who are taking pictures, that we need to see the two right there. Thank you. Appreciate it. And ladies and gentlemen who are in the audience, we have a very short time. We have only an hour to go through the budget for UConn and a half an hour for UConn Health. So we're going to ask you to, you can flash your signs and, you know, do that kind of thing. But if you could just be quiet so that we can hear what they have to say, because we have to understand all the numbers. And that's why we're here today, is for the numbers of that. We have to gather the data. So I'm going to ask you to just, you can fund the future, fund UConn, whatever you want to say. You all have your t-shirts on. We get it. But we would really like to hear what they have to say. Because if we don't understand what they have to say, we're not going to be able to address the issue. All right? So I appreciate all of you for coming. Pleasure seeing you all. But and you have a lot of supporters here, but if we could get the numbers, that would be super great. Okay. All righty. We're gonna dive right into it. Diving right into it. So President Merrick, thank you very much for coming today. Appreciate it. I see that you really don't have your team here today. I guess you have your extended team. But if you wouldn't mind going through the numbers. And so that would be really helpful. Just give us an overview of what you have in front of you, and then we'll ask questions. We have a lot of questions, so.
Thank you, Senator Austin, Representative Walker, distinguished members of
Is your microphone on?
Yes. it is.
Appropriation Committee. I'm Radenka Merrick, President of the University of Connecticut, and I'm very pleased to have and be with you today to discuss the proposed budget. I have my team members with me, Jeff Kagan, Chief Financial Officer of UConn Health and UConn, Bruce Liang, Interim CEO and Dean of School of Medicine of UConn Health, Ann Deliva, Provost, and Nathan First, the Vice President for Students Enrollment. We are so deeply appreciative of the support of General Assembly, our governor, and many previous governors that have given UConn over decades. My testimony has been submitted to the committee, and we are ready to answer questions.
Thank you very much. So I'm going to ask a couple of basic questions that we ask every time you come in front of us. We have a position count for the University of Connecticut as for fiscal 24, 4,113. I'm assuming that's combined with UConn Health. Can you let us know what you have for a position count and how many vacancies you have that have been priorly approved to be filled relative to the state budget?
I will ask CFO to respond to that question.
Good afternoon, Senator Jeff Kagan here. So the position count that you're referring to, I believe, is the count that is on the OFA report. That count is directly related to the general fund. And number one, you are correct that that is the combined, when they combined UConn and UConn Health. That count, though, is just a number that's been used and rolled forward in the budget. Again, UConn and UConn Health actually have our own hiring authority. So it does not apply to overall the hiring or the overall number of employees on the campuses. It's supposed to just relate back to the portion related to the general fund.
So if you could bring to the subcommittee the number of people that are related to, please separate out UConn and UConn Health for us at the subcommittee level that are related to the general fund side of the budget. And if you could also let us know the other folks that you hire at UConn and UConn Health relative to either research or tuition funds that you are using and what funds they are associated with, so that we can understand the difference of that. And then if you could let us know if you have any contracted services at UConn, for example, for food service or for maintenance or for whatever may happen to be, so that we can get a generalized picture of the overview of all of UConn, and just bring that to the subcommittee.
Absolutely. We'll get you the FTE and the dollars by fund.
Thank you very much. We appreciate that. And just so everybody understands, we will have subcommittee meetings after this that we delve into even a deeper dive into the budget. So when I'm asking them to, I'm just telling you so you all know what's going on. That we ask them to bring to the subcommittee more detailed information so that we can make a better decision based on everything. And relative to what you put in, what I have as what you put into the budget was 238 million in year one and 239 million in year two and change. That I'm assuming that that is just UConn. Is that true?
In the agency request line, yes, that is just UConn. On the following page, or it's probably 2 or 3 pages later,
Yep.
you'll see the UConn Health, and that's the 150,675.
Yep.
So on UConn Health, that is completely removed in the proposed budget and just added into the governor's recommendation. Of note, though, just to ensure everybody, that just includes the block grant portion. It does not include the fringe benefit or the fringe benefit
The legacy cost
proposals
component.
of those aspects. So you'll notice that a lot of other items will have much greater number
Right.
because on top of that, you have to add that fringe portion.
Right. Legacy costs.
Legacy cost and
Legacy cost.
the amount
Yep.
in the traditional, it was, we spend 100% of the block grant on salaries.
Yep.
And then we get fringe, in-kind fringe benefits, or the state pays the fringe, total fringe benefits for those employees. So not only in the historical methods that we'd get the 238, we'd get almost a dollar for dollar match of fringe benefits on that also. So there is, if I could refer to page 34 in our information that we actually provided in our handouts. On page 34, you'll see that in fiscal year 23, we're starting with a number of $905 million. That includes the legacy costs, the fringe benefits, and the block grant that we were discussing.
So we like to make sure that we're referring to specific things. The legacy costs are the unfunded liability that the state has on all state employees relative to the 70 years of non-payment of pension costs related to the 1930s until Governor Malloy came in and said, I won't sign a budget without you paying the ADAC for the pension costs. And I think people get lost into that thinking that a state employee is a very expensive person, but if we remove the legacy costs, they're really relatively normal costs for employees nationally. It's not a huge increase. So I want to make sure that we are explaining that. And you and I have gone around and around on legacy costs, and that's why I want to make sure that legacy costs are identified as what they are. So
Exactly.
thank you. Representative Walker.
Thank you and good afternoon and welcome to the general legislative office building. Whew, that was a lot. First of all, I'd like to welcome all of the new future of Connecticut here in the room and say thank you for coming out and advocating for yourself, because it's important for everybody to see the importance of it. And before I ask my question, I'm going to ask the audience one question. I want everybody in here who voted at the last election, please raise your hand. I just want everybody to know that we all work for them. So just to let everybody know they're doing their civic duty. Thanks. And good morning, good afternoon, Madam President. I have to give a funny story. Madam President, when she first got here, she was eager and she got very active on trying to communicate to everybody. So at 4:10 in the morning, she texted me And I was shocked because I was up working and I texted her back and she was even more shocked. So that just shows that people get up early to do their job. And I thank you for everything that you do for UConn. Can you just give me a brief response for why you don't feel the fringe benefit package, besides the cost, but there's got to be some other major impacts of why this does not work for UConn?
I can
Hold the
start by,
microphone closer to, because it's.
yes, I will.
Thank you.
I will start. I think we have a number of conversation with OPM Secretary Jeff Packham, and he understands the difficulty that we have with unpaid legacy costs to make us competitive when it comes to the federal funding and research. So it's a huge burden for us, and what he tried to do is to elevate that burden for us. But the way how it has been proposed or elevated is not going to work for us, because it is taking the money from somewhere else to pay for the unpaid legacy costs. So I would like to have Jeff Kagan to elaborate more why that proposal, the way that it is not working. But in the general term, lowering the fringe rates is going to make us more competitive as a research institution.
And that would definitely make you more competitive, but taking it from your block grant defeats the purpose.
That's correct.
You can pay it off that way if you wanted to too, so
Yeah.
that doesn't help. But in looking at the proposal, I guess the other question is, how do we make people in Connecticut understand that it's not a dollar for dollar situation with what the proposal is? And what should we be looking for to try and make it more of an equitable proposal for UConn? Understanding that both sides have to have a come together moment in the middle. So help me get to that.
Thank you for your question. I think I will start by saying, what is the value of flagship and land grant university for Connecticut state? We are only flagship university of this state. What that means that we are accessible and affordable for the citizens of Connecticut. We play the role in economic development and prosperity of the state. 77% of UConn graduates who are the students in state stay and work in Connecticut. There is no company in Connecticut that doesn't have the graduates of UConn. People are talking about investment of that state made for last 30 years in UConn, and we are very grateful. I'm part of that investment. In 2008 and 10, Connecticut was looking for the world-renowned faculties in clean energy, and they brought me from Canada, Vancouver, Canada. I came here because I believe in the value of education, and I believe in the value of our students and the accessibility of education. I believe that our strengths are students behind us. With the great education, they're going to stay in this state and be very productive citizens for economy and all other impacts that we have in state. I want to give you examples. I put one in my testimonial. Vladimir Korik, the CEO and chairman of BioHeaven, is a son of parents immigrants who came to this country to give the better future to their children. He went to UConn, he went to undergraduate, and as an undergraduate student, he started to do the research in avian phosphate transport in renal tubes. He graduated from UConn, pursued medical school in North Carolina, and came back to UConn. In 2013, he started BioHeaven company in New Haven. Last year, he sold the company, or it was acquired by Pfizer, for $11.6 billion. This is the impact of UConn education. This is when you invest in research, when you invest in our faculty, when you invest in our staff, and when you invest in our state, our students, this is return. People will stay, people will enjoy the life, and people will be productive members of society. So that's why we have flagship and land grant university.
Thank you. Thank you very much. Thank you for that statement. And I so appreciate what you're saying. One thing though that we do have is we have the flagship and then we have the state universities. We cannot take one baby over the other. So in going forward, one of the things that I think we need to talk about is more partnerships between the two entities. Because pretty soon it's going to morph into one in one way, shape, or fashion. But I think it's an opportunity to make sure that every child that wants to get a higher education has access. And then at some point in their higher education, they can touch each one of those, the flagship, the foundation schools and everything. So I hope that I don't want to create animosity between the two entities, because I think the best thing is having us in a room with nobody else and figuring out how we can do it together. So I look forward to that. We'll be having those discussions, and thank you for your testimony. And I think it's great that you get up at 4 and start working. Thanks.
Thank you. I really appreciate your comment. And first week in my job, I went to Goodwin College and I invited the president to collaborate, and I meet with other presidents, because investment of this state to Yukon is investment for all, and we can leverage on that investment.
Awesome. Thank you. Thank you. Thank you, Madam.
Thank you. Representative Nuccio.
Thank you, Madam Chair. Good day.
Thank
Thank you
you.
guys all for coming. I'm going to try to keep it succinct because we only got so much time to go over this, and we have subcommittee meetings where we can really dig in. But the questions that I have, first of all, if you could just elaborate. I've kind of heard some mixed things on how you guys feel and how other people feel about the combining of the block grant. I'd like to just get your opinion here and on the record for what do you feel about combining UConn Health into the one UConn vision?
Thank you, Representative Nuccio, for that question. I'm a big proponent of leverage, avoid redundancy, and improve efficiency when we can do that. So we had been looking what are the areas that we can combine operation to control our expenses. So Jeff is perfect testimonial of the decision that we should have one CFO. We have one vice president for research. We have one sponsorship program between UConn Health and UConn, but we cannot take over operation of the hospital. None of us can be nurse or surgeon. And that's the reason, because of the hospital, that we have to separate two budgets. But when it comes to operation, we are looking how to leverage. We are looking at accountability. We are looking for our efficiency.
So I'm not sure if I understand totally. Are you supportive of the one UConn, the one block grant? Or do you think this is something that needs to be revisited?
No, I think it has to be revisited because of the hospital and the way how hospital operates.
So you're thinking more combining the administrative and the higher level regionalization of that kind of a thing.
Correct.
So we don't have duplication
Correct.
In some of the higher level,
Correct.
higher paid administrative areas.
Correct.
Okay, so half and half then.
Correct. Thank you.
Okay. The next question that I have is just, there's a lot of consternation around, what I'm hearing, which I believe is misconstrued information about like the funding of UConn, right? And the big piece of that is in relation to the ARPA money, the federal money that pretty much came to everybody in the world or in the United States here saying that, this is not money that is going to be continued. So with the money that you've gotten, and those are the emails and such that we're seeing, is going back to this $1 billion funding, which UConn never got from the state. And the state doesn't have the capacity to provide. What are you guys doing to kind of step down from that ARPA money? I know this budget from the governor does include, I think, another $150 million in ARPA money over the next 2 years. So how is UConn looking to kind of resize and readjust expectations to not having this federal money that the state can't provide?
So we had been having internal fiscal planning and discussions, how we save, how money follows the students, where are the priorities. For me as a president, students are #1 priority, and money has to follow students. So we are looking what we can cut, how we can improve efficiency. I sit down with Secretary Beckham. We talk about those numbers. I present on quarterly basis to him where are the savings that we done and what we are doing. But to go to this magnitude, it's not possible to happen overnight. So we have to look strategic planning, looking the numbers, looking enrollments, looking the needs of the state, looking what are the areas that we reinvest and what are the areas that we sunset or think how to collaborate with others. So I will have Jeff Kagan to respond to the ARPA money and what had been the plans around those.
Thank you. For the ARPA money, it should just be noted, first of all, we've never asked for ARPA money or for ARPA dollars to continue. I fully agree that as the governor has funded the original block grant and then has maintained and increased the funding to that, the additional requests that we have stayed the same since 2022. So in 22, 23, and in 24, what our requests are based on is the block grant, and then basically the collective bargaining increases for all of our employees, and then the legacy costs, which we've talked about for numerous years for it. Last year, at the end of the session, our final budget did include ARPA funds for supporting the university. So what we have done is we've met with OPM, got the authorization for the funding and the spending of those funds, and we report out. But again, I guess now coming back to 24, our request is not for ARPA funds. Our request is we would rather have this in the block grant and rolled forward as we move forward.
Well, I think that might be what I'm not understanding, right? Because, and I think possibly when we get to the subcommittee, if you guys can provide that information, I think that would be useful because the slides and such talked about UConn receiving the almost $1.1 billion in state money. But that was a combination of state money and federal ARPA money, right? So I guess I'm not quite sure what it is you're asking for, because as you yourself noted, state support in the block grant has gone up every year. UConn has not been cut. So my concern here is what I'm hearing and then what I'm seeing. I need to understand where you feel like the additional money that you're getting this year is not adequate, and what is that supposed to be supplanting, and is it any of the federal money, which everybody knew was one-time expense? So I'd like to understand that for our subcommittee coming up, if you can provide slides and information on how UConn has spent the ARPA money, and if your assumption is that it's going forward, and just kind of the disconnect between, the block grant is going up, but I need to understand what numbers.
Correct, sure, and we will definitely do that for you.
Thank you very much.
Thank you. Representative Haddad, followed by Senator Hartley.
Thank you. And thank you for your presentation. It's good to see you, and it's good to see so many of the students here. I said hi to you guys outside. I'll say hi to you again here. My question gets at something that was in the governor's narrative around options that UConn has to close the gap. So what doesn't seem to be in dispute is that there's a difference between what the university has said it needs in order to function and what the governor's provided. And that gap is about $160 million over the biennium. He in the budget narrative, they go through 5 different options that you can use. And I wanted to ask you if you could comment briefly. I mean, we're limited on time, but briefly on what you're doing already, perhaps, in terms of these options and what you think should be off the table for further consideration. Those 5 options were, he suggested there be efficiencies from combining UConn and UConn Health, that you could increase the amount of research grants that the university successfully obtains, that you could increase class size by changing the faculty to student ratio, that you could fundraise more, and that you could accept more in-state students instead of, you could accept more out-of-state students instead of in-state students, and you could increase tuition. And so those are the 5 options that the governors have outlined to close a gap of about $160 million. I was wondering if you could just give us sort of an overview of where we are in terms of pursuing those strategies and what you think you could reasonably accomplish using those strategies to close the gap.
So let me go with the last one. I truly believe that education should be accessible and affordable. So the last thing that I want to do is increase tuition for our students. I want our students to be successful. We are number one in the country when it comes to time to degree, 4.1 year. And I'm so proud of our hard-working students because that's success. I want to increase success from 86% to 90%. 90% of the students that enter University of Connecticut should graduate. They will not be able to do that, those two things, if we have larger classes, less advisors, less support, less cultural centers. I want to stay with that. What is the healthy ratio? Yes,
Just to clarify that one last point, I just want to be clear. Have you done a calculation of what it would cost if you were to increase tuition to close the budget gap with, you know, how much tuition would have to increase if this budget were to be adopted?
Just for store alone, 3,000 more. Second point, the ratio of the in-state and out-of-state. Again, access to students of Connecticut. 70% of students in University of Connecticut are Connecticut citizens. I want another number to stay with us. 77% of them, when they graduate, stay in Connecticut. If I look the numbers for out of state, 18% look for the jobs in Connecticut. So this is now a question for all of us to answer. Is University of Connecticut economic and social engine of this state? And I will leave it there. Third question, I'm going to industry. I sit with Pratt & Whitney, CEO. I sit with Synchrony, CEO. I sit with Harvard Health, Jeff Flex. We talk about scholarships. I want more scholarships. I want more support for students. I'm sitting down with donors, but nothing happened overnight. 2 days ago, I had a conversation with a medical doctor from UConn who is not any longer here, but he says, Rodenka, now is first time that you have working class children making money that they can give back to University of Connecticut. I'm third class of School of Medicine, and now here is my commitment for scholarships. Nothing will happen over time, but I said student first, UConn always, excellence always, and Huskies forever. We need people who graduated to be a part of our network, to help us with mentoring those students who are in this room, to help them with the jobs, because 8,400 students of University of Connecticut are first generation students. They never had the mentors, and the only opportunity for them is University of Connecticut. So that's why students first.
Thank you. And just to follow up on the in-state, out-of-state thing, have you done an analysis of, you know, if you were to significantly alter the in-state versus out-of-state ratio, and you were to lower the percentage? I'm not suggesting this. I just want to know what the answer is. Lower the percentage of in-state students to say 60%. Could you provide now or at the working group an analysis of how much that would really mean in terms of closing the gap?
We did analysis, and if we take 1,000 more out-of-state students, we take now about 4,100 students we are going to administer, and we have to send letters by March 1st. We are going to close gap of 10,000 because out-of-state students are expecting scholarships as well. And we provide about 170 million in the scholarships.
Thank you. I'd like that in writing if that could be helpful, because I think it just shows that if you change the in-state, out-of-state mix, it just doesn't realize the savings that you might expect, and certainly that were suggested in the governor's narrative.
That will only work if we significantly increase enrollment, but the difficulty in increasing enrollment is size of the classes, mental health support, cultural health support, dorms, and all this support that we have to provide to students in order to be successful. So if we increase the classes, our students will not graduate in 4.1. They're going to graduate in 5 or 6 years.
Thank you.
All set, Representative? Thank you. Senator Hartley, followed by Representative Dathan.
Yes, thank you, Madam Chair. And welcome, Madam President and staff and students. So yeah, we're really looking forward to getting through this budget in a very instructive way. And I first of all want to commend you, Madam President. I think maybe this is the first time you are before us in this capacity. So congratulations, and we are really looking forward to your leadership. We hear you loud and strong. But let me just, so when we get into our work sessions, we'll have a chance to really get in the weeds here. You may have talked about this, and I apologize if I missed this, but I'm interested in the historic profile, if you will, of your enrollment numbers. I'd like to see that over a 10-year period. Where we are now, we're talking about, changing in the demographics of our student population, quite frankly, in all of our education institutions. I'd like to have that view. And if you have projections in the out years, that will be instructive. And in particular, if you can break that down by regional campuses. And I want to, first of all, recognize and commend you for the leadership very early on that you have demonstrated with regard to growing those campuses. We are a small state, but on the other hand, I know, for example, and I know you appreciate this, I come from an area where stores is just too far away for a lot of reasons. And so therein is the incredible value of, reaching, our first generation students and allowing everybody to have that opportunity for flagship education. I would also like, and I think this question has been asked, but it would be helpful to have a breakout of the ARPA money and how that was spent. So we can just see, quite frankly, where the gaps are, because a lot of this conversation centers around that. And then lastly, when we get into those work sessions, we are embracing a program called the Global Resident Entrepreneurship Program, which talks about the H-1B visas and those students coming in. We educate many times and we lose those students. And this is an endeavor to try and work with all the good programs that have been developed at the university, like the TIP program and so forth. So we're looking to try to, quite frankly, it's the Massachusetts model. I'm sure you're familiar with it, to try to scale that. So to be continued. And thank you so much for all that you've done so far. Thank you, Madam Chair.
Thank you. And just so everybody here knows, we have a lot of other committees going on at the same time. But importantly, the Appropriations Committee has briefings on 2 other sections of the budget. So the ranking member and the chair are going to go do those while the rest of us are here, just so you understand that people are not leaving because they're not interested in what you have to say. But we are extremely busy and have to have people in those meetings so that we can get the right information. So up next is Representative Dathan, followed by Senator Flexer.
Thank you very much, Madam Chair. And it's nice to see you. And thank you for bringing your staff. And most of all, thank you for bringing so many students. I mean, I'm sure you didn't have to encourage them. They probably were driving you all up here. So thank you so much. One of the things that we talked about earlier was return on investment on the education of the CSCU system, and was curious if you all have done anything similar as part of your sort of analyses to talk about the sort of return that students get either in a 10-year or 20-year window. And if that's something you could bring to our committee, I'd really like to see that. Because some of the items that are discussed that, potentials actually really affect that ROI analysis in terms of increasing fees. If that's causing, $3,000 more of student debt, which we all know is really a delay for students to buy houses, start businesses, get on and maybe even start an extra degree after that. Changing the mix of state and out of state would definitely affect that, because a lot of, if we're talking that 77% of our Connecticut residents are staying in state, that would go down quite substantially, and that would change that ROI. So that's a really sensitive thing. And then, of course, changing class sizes, that could increase an extra year of tuition. So all of those things would severely affect that ROI. One thing I wanted to, and this is my second question, for the avoidance of doubt, talking about efficiencies and synergies from different combinations. I used to do M&A. So for me, I always looked at that as part of my analyses. And I'm wondering, has the university thought of additional, I know you have a joint CFO, which is great, but is there additional synergies that maybe could happen between the two organizations outside of a total combination of the two?
Yes, we are looking when it comes to administration, but we are also looking when it comes to the synergy of the faculty for collaboration, for teaching the classes, for providing more support and the staff. I mentioned CFO, but we have vice president for research office. In the sponsorship office, we have 25 people who are working between Stores and Farmington. So whenever it's possible to have the synergy, we are going to look for that. Because as I said, my focus is on dollars following the students. And the more of those dollars we free for students, we are going to make sure that they are successful. And we have a lot of investment. We have a lot of needs. COVID was not just one-time investment. I can tell you for the well-being and mental health of our students, we invested as university 12 million in 2018. Now it's 20 million with request of 25 million. So that didn't go away with the COVID. We have the consequences of the COVID that we have to address. But that's why, we are lean on other things in order to provide that support for students to be successful. So we are going to break down for you where we are doing the cuts when it comes to operation or synergies. I don't like to call the cuts, I call it reinvestment or strategic investment. And what is our plan?
And I would just add, as the president said before, we've already done a lot of this work, and a lot of the items the governor actually presents are ongoing items we always look at. Just example, it's not even administration, but years ago, we looked at public safety. Well, we needed public safety in Farmington and Waterbury and Avery Point. And so we have one public safety office that can utilize all of our public safety officials throughout the state at all of our campuses. So we do similar items with communications and a lot of other departments. But as you said, that's an ongoing effort. That never stops. We'll have to continue that. And then just to point out in your package, we do have some slides directly pertaining to ROI. So there is one on graduates just for you, but just one item we would like to mention. There's a $1.2 million return on investment for a UConn bachelor's degree over a 40-year life. And then additionally, we have the state investment. So the return on investment on the state investment overall in UConn is 6.9 billion returned back to the state in various ways of downstream taxes and a whole bunch of other items that we have. But we'll make sure we get that more detailed information to you also.
Yeah, I saw that. I was actually more referring for the students so that we have something to say, this is why you choose UConn, apart from the wonderful teachers and the wonderful everything else.
Correct. And we'll definitely continue to, we have a lot more information on that and develop
And just
that
to add in terms of synergies, I seem to remember a couple of years ago that you had separate purchasing departments between UConn Health and UConn Have you revisited that? Because that could definitely be a synergy. Sorry if I'm preaching to the choir.
So, no, I fully agree with that. We have combined, they both actually purchasing departments report up to me now centrally. So as we make those decisions, we work across campuses. The major differentiator though is the clinical. So in Farmington, we do have a specialized group that does, you know, pharmaceuticals and clinical type items that there. But overall, if we're buying computers or something that we can do a combined contract, we look at that to make sure all campuses are covered.
Okay, thank you so much. Looking forward to the next discussion.
Great.
Thank you, Madam Chair.
Thank you. And I just wanted to point out something because, you know, we have a lot of people here today. And you were able to, and I'm not certain who paid for it, I don't really care. You were able to bus down students from the main campus, correct?
That's correct.
So we had earlier today, we had the state universities and community colleges. And a community college is where I went to school after I got out of the military. And that was a long time ago, I'll grant you. But they don't have the capacity to bus students here because many of those students are not living on campus. So this is not to say that those two institutions don't have similar supports. So I just want to point that out because I would never have at that time frame in my life been able to come up here. I would not have the capacity to do that. Mostly because I didn't really have a car back then and I would not have been able to get back nor get up there. And I had a child to pick up. And that's often the case in people that are going to the community college system or the state university system.
So Senator Austin, if I can elaborate on what you said, you know, we didn't pay for students. Students organized themselves.
I'm not saying that. I think that I saw a lot of the social media stuff, but what I'm saying is that we couldn't, what I'm pointing out is the difference between UConn and our state university systems and our community colleges. What I'm pointing out is that those students care just as deeply about their college, their school systems, but don't have the capacity to be up here. So that's what I'm saying is that that is the difference between a community college, state university. Many people don't have the capacity to do what has happened here. And it happened in many ways in an organic way. But I just want people to understand that we don't fund just UConn or UConn Health. We fund state universities and community colleges. And this is a year of suggested great change for each one of those college systems. And I just think that we have to recognize the fact that by the extraordinary effort that the students did, but also the extraordinary ability to, most of them live on UConn. Most of them are not working a second job or a third job. So I just pointed out because those other students also care about their school systems and we have to figure out how to fund both school systems. So I want people to understand that, in particular, those who are taping this and the people that are here on reporters, that we have not just one higher ed system. We have essentially 3 higher ed systems that we are funding. So the next great supporter of UConn, Senator Flexer.
Thank you, Madam Chair. I was going to lead just into my questions, but first of all, I want to thank you, President Merrick, for being here today. I'm very pleased to see both Madam President and Madam Provost here. The first time the university has been led by 2 women. And I guess I do want to just say a few points. I'm a proud graduate of Quinnipiac Valley Community College and the University of Connecticut. And I had to work 2 jobs when I went to community college, and I had to work 3 when I went to the University of Connecticut. I know it's not appropriate for people to applaud. And I want to thank the students for being here. I want to thank them for organizing, many of them not for themselves. A lot of you in the crowd today are seniors and you're organizing for the students who are going to come after you. And I know that it was the undergraduate student government that gave the resources to respond to the student needs today. And I'm also actively involved, listening to students and to students at Quinnipiac Valley Community College. And I know that they have resources for their student government to take bus trips places. And so you all chose to use your resources to come here today. And students at other community colleges have student governments that use their resources to better and enrich that student experience. Madam President, I'm really glad, like I said, that you're here today. And I wonder, one of the responses we've been hearing to the governor's budget proposal, and one of the defenses of it, has been that the University of Connecticut needs to be more like other top tier research institutions in its both its mix of in-state versus out-of-state students and also its mix of state funding. I've heard specific comparisons to the University of Michigan and the University of Vermont, that those are institutions that get a much smaller percentage of their state funding from their state government. And I wonder if you could just speak to that difference a little bit. And I actually think, and I actually know from sitting in this committee for, I think, about a decade, that many of my constituents and many of my colleagues here in the legislature have been concerned in recent years that UConn is already trending in the wrong direction in terms of the trend to more out-of-state students. Now, don't get me wrong, we love the out-of-state students too, but there are a lot of people who are concerned that their children from Connecticut have difficulty getting into the university. So I wonder, Madam President, what your response would be to the notion that UConn's future should be based on having a larger share of out-of-state students.
Thank you, Senator Flax, and thank you for supporting us for so many years and coming to so many of our events. I think it's important to compare apples to apples. And I sit as a reviewer for the federal government, for Department of Energy, for National Science Innovation and other one. There is no other state university that has unpaid legacy costs put on the university and higher education. So that is what makes us less competitive. So as long as that is on our books, we do not have control. And it's not favorable position when you don't have control. And I will illustrate you by numbers. In 2018, unpaid legacy costs, or whatever we call it, was 58 million. Today is 106 million. What is going to be in 2 years? I don't know. But when I ask these questions, the answer that I get, we are not going to be out of this in next 30 years. I'm not going to be president at that time, but I think we have to do something today because that makes us less competitive. And when we remove that barrier for our higher education, then we can compare University of Connecticut with Michigan and any other university. We have to be more active in working with industry, aligning our priorities, getting more scholarships. Our graduates are becoming successful in the world. We are going to be more proactive with donations, but that's a time, that's all of those activities take time. So the important thing, how important is UConn for the small businesses in Connecticut? 80% of the businesses in Connecticut are small and medium-sized businesses. They will not survive without our support. During the COVID, our faculty, Dr. Jeff McCutcheon, produced 1,000 sanitizers in his lab for free and distributed to communities and hospitals with his students. We provided support for over 200 companies last year alone for free for them to stay in businesses. So we have to be very careful when we go granular and compare what state universities are doing for their states.
Thank you, President Merrick. And I really appreciate that response because one of the other things I was thinking about in coming to this meeting today was just from my own perspective, and I'm sure my colleagues have something similar, even though the main campus of stores might not be in their district. When I've had issues looking at how the state, in my role as chair of the elections committee, looking at that, the incredible resources that you can find for support at the University of Connecticut. I mean, it's hard to put into words completely what a resource, both UConn and all of our universities, they all play significant roles in supporting other functions of the state. In our region in northeastern Connecticut in particular, we've had a real crisis in the delivery of healthcare, and some very serious choices have to be made in recent weeks to be able to turn to UConn and UConn Health to be potentially a part of that solution. I don't know what we would do if the university wasn't there. I don't know what other solution there could possibly be if it weren't for the university. So I appreciate your point that it's really hard to quantify some of the things that UConn brings to the table and enriches in our state. Can you also talked about the mix of in-state, out-of-state students and the increase in enrollment, and how we would potentially be moving away from the current 4.1 years to completion to potentially 5.2. And I want to point out, that's not just a student paying an extra $3,000 in tuition for that 1 year, but it's potentially a whole year's of additional debt. And it will result in the need for you to hire more faculty. And it's a real burden for first generation students, because it's first generation students where many of the financial aid programs, Pell Grants, et cetera, they run out after 4 years. And so then we have a higher percentage of people who never complete and are carrying that undergraduate debt and don't have the piece of paper they worked so hard to get.
Thank you so much, Senator Flex, for that question. And I would like to refer to our provost, Ann. So what increase of the classes is going to do for the quality and time of the students to graduate in 4.1 year?
So thank you, Senator Flexer, and thank you, President Marek. I think what we are so proud of.
So, excuse me, if you could just say your name for the record.
Yes.
So that when we're taking the minutes, we don't have to guess.
And Aleva, Provost. So what we're so proud of at UConn, of course, is the quality of our education and the time to degree, 4.1 years. So these are precious resources that we want to preserve at the university. So when we increase class sizes, and there are times where we can increase class size productively and in a way that does not undermine students' education, and we do that. We're constantly looking at that in my office and with the deans across disciplines. But if we increase class sizes too much or in ways that undermine student learning, we're going to increase that time to degree. So there's a balance there, and we are looking for that right balance.
Thank you. And thank you again all for being here today. Thank you, Madam Chair.
Thank you. Senator Slapp.
Thank you, Madam Chair. And thanks for all coming in and for the lively rally outside, which thankfully the weather cooperated. So that was terrific to see UConn Nation flex its muscle. I do have a question about UConn Health. And so that may be this team and Dr. Liang, perhaps, but there is this, I think, perception that, UConn Health is a money pit. I've heard it referred to that in this building. And so wondering if you could just describe the steps that you've taken to, one, I guess, improve, right, the fiscal health of UConn Health, but also identify some of the constraints that you all have in terms of that maybe some of your competitors, I don't know if that's the right word, but maybe don't have. And then, it's in that context that I know myself, I'll say that I have some concerns about the combination of the block grant. I think efficiencies are great and some have been identified. But many of us are concerned that this is the beginning of kind of a disinvestment from UConn Health, or perhaps UConn stores, or perhaps both, right? I represent West Hartford, Farmington, Burlington, and Bloomfield, communities that are I feel like almost every street we go on, there's somebody who works at Jackson's Lab or UConn Health, or somehow is touched by the investment that the state makes. So I see it, my constituents see it, even if they don't work there, they see the impacts of the economic impact of UConn Health, let alone the health benefits. So I know that's kind of a long-winded question. I am a politician, so that's kind of what we do. But anyway, I'll leave it there, Doctor. And I appreciate your all the work that you've done and look forward to hearing your answer. Thanks.
Thank you, Senator Slapp. So my name is Dr. Bruce Lian. I'm the interim CEO at UConn Health and also Dean of the School of Medicine. thank you for that wonderful questions. So in terms of the clinical enterprise, we have worked very hard in the last 10 years to be more efficient and at the same time grown. So we have doubled our clinical revenue. And in doing those things, we actually cut the shortfall. In summary, if the legacy cost is removed and the fringe rate is the same as the area hospital's fringe rate, and then there's a big thing that we do, which is the safety net care that we provide to the underserved populations, such as tertiary specialty surgery, cardiac, vascular, spine, ortho, neurosurgery, which are not readily available or offered by the private community, Sickle Cell Institute, Poison Control Center, and one of the largest single mental health providers for those in the underserved community. We will break even right now just purely on clinical. And the last 2 years, we were fortunate to have the state and the governor's support, who removed the legacy costs from us, and we actually turned a surplus relative to the budget. And so it shows the efficiency we've been able to manage the clinical enterprise. So there's I think it's a myth that you could, for a public academic institution like us, you could just peel off the clinical enterprise and focus on research and education. That's a myth, because our clinical faculty not only provide care for the patients, including the underserved, but also train the next generation of doctors and dentists, surgeons and physicians. In fact, we're the leading source of future doctors and dentists for the state of Connecticut. And the reason for that is very straightforward. We take majority of our students from Connecticut. I will venture to say every son and daughter of Connecticut who aspire to become doctors apply to our medical and dental schools. And they are so good. They are really just, we have no shortage of excellent candidates, 40-1. That's the ratio of the application to one student in the medical school. And because their families are here, when they finish training, they want to stay here. They want to stay close to their parents who might be aging. And so that's why we are the leading source of future doctors and dentists for Connecticut. And also our faculty perform cutting edge research. They're not just seeing patients, training the next generation, they perform cutting edge research. I'd like to give you an example. There's a condition called glycogen storage disease. Opposite diabetes, these children with this disease have low sugar. They have to take sugar, not just simple sugar, but complex sugar like starch every 3.5 hours, 24/7. And their parents have to get up in the middle of the night to make sure that these kids with this disease take this starch, otherwise their sugar will plummet. And that's not a good thing. And our doctors are performing the first in the world gene therapy trial to correct the underlying disorder. We also simultaneously work with Moderna, which is a household name now, using the mRNA technology, the same technology that produced the vaccine for COVID-19. And that's being adapted to correct this disorder. So I'm happy to tell you that early evidence suggests that the time from 3.5 hours to take the next dose of starch is now 6.5 hours. So the parents can get through the night, get some sleep, and the kids don't have to worry about their sugar plummeting. And this is what our faculty does in the clinical domain, not just seeing patients, but also teach and carrying out cutting edge research. And with the safety net care, with reducing the fringe rate to that of the similar hospitals, we will break even just by the clinical enterprise alone. I'm sorry, there's a bit of a long-winded answer, Senator. Hopefully that answers your question.
Absolutely. No, I followed along. Thank you very much for the comprehensive answer. And what I'm hearing, well, I won't put words in your mouth. I'm heartened to get the message from you. I think that we don't need to privatize UConn Health, which I don't support, and many folks do not support, in order to run a good fiscal operation. And so I appreciate I know you didn't say that in those words, but nonetheless, I appreciate your message. And the other thing, I think I may only get one question, but I do wonder, this is actually a very quick question, is that do you believe if the proposed budget for UConn went into effect, that a few years from now, UConn would still be a top 25 ranked public university? Thank you.
With the proposed budget right now, absolutely not. Because best faculties have the option to move, and our students will not come to UConn if we don't have the best faculties. So there is interlink there. And as I mentioned last year, 5 of our faculties has been the most cited faculties in the world. Those faculties have offers everywhere else, but those faculties stay because they care. And that caring, and for how long they stay in Connecticut, matters to this state and matters to our students.
Thank you. Representative Hoxa.
Thank you, Madam Chair. And thank you, Madam President. Nice seeing you again, and the whole, UConn staff that is present here today. As a former UConn grad myself, having done a few years at the West Hartford campus when that was still around, and then Storrs, and having worked my way all throughout college and commuting, even when I was up at Storrs, I can certainly understand, the diverse, socioeconomic backgrounds that are represented by the University of Connecticut. My question to you, and maybe a representative from the health center could also speak on this. You had mentioned that, the block grant is not particularly efficient as it relates to, the needs of the health center. You had mentioned something in regards to the hospital, and, how you would prefer that those two things are separate. Can you explain a little bit, expand on that as far as what is it? Why are the needs of the health center unique in that regard, and why does it matter whether it's a block grant or a separate grant?
I will have a CFO to answer that question.
Thank you, Representative. I think one of the concerns is the separate operations. If we do combine into one number, then it'll start to get muddy of what items were supposed to be funded for students, what items are actually supposed to be funded for research, and then are there anything specific that go to the clinical enterprise? So as we know, right now, there is a definite line between what is for Farmington and the health center and what is for Storrs and the regional campuses. As that combine and the years go down the road, it'll just be one number. And the concern is, will Hartford or one of the regional campuses and Storrs be looked to pay something over at the Farmington campus, or vice versa on that? So I think the theory of combining them is not in dispute for it, but it's the actual maintaining the line of sight to where the money is actually going and what's being spent.
Thank you. I believe I understand now. It seems to be an issue of kind of almost a perception of what is made available, what is available to these two. I don't want to say competing organizations. You're all under the same institution, but and correct me if I'm wrong in how I'm understanding this. By making it a one block grant, it opens up the possibility for conflicts in terms of where that money is ultimately spent. But so as opposed to if it's separated, there's the expectations are set differently as far as the two different entities. Am I correct in kind of conceptualizing it that way?
Absolutely.
Thank you. No further questions.
Thank you, Representative Reyes.
Thank you.
Thank you, Madam Chair. Madam President, good to see you. Welcome to your staff and your student body that came down today to make the trip. Unfortunately, I'm not a UConn grad. I couldn't afford to go to UConn, but I am impressed to hear the 8,400 first generation students that are at UConn. I am a product of the state university. I graduated from Central, and similar to many of my colleagues, not only did I have a day job, I actually had a night job at Pratt & Whitney. So I had an opportunity back then that probably isn't affordable to a lot of people right now. But my question to you is twofold. Number one, I'm very proud of the work that you guys have done at the University of Connecticut at Waterbury, and what you have done expanding that health and that health ally program. My first question is that program successful, and is it sustainable, number one? And then number two, you made a statement about the Excel Center, and I'm curious as to, does the University of Connecticut actually make money when it plays at the Excel Center, or is it a losing venue?
About Excel Center, I will have Jeff Gagan to respond, but about the Waterbury, I will say that I'm proud of our presence and expansion in Waterbury. Like you, many students of Waterbury work 2 or 3 jobs. They support their families and they cannot commute. And in order to ensure success, we put our best faculty to be director of that community and Waterbury campus. She is not only present in the classroom and students and staff, they go to community. They understand the pain of community. They collaborate with the Waterbury Medical School. They're looking for more scholarships. They're looking for more entrepreneurships. They're looking to get more external outside stakeholders to provide them more scholarships. So I believe down the road in 5 years that Waterbury campus, as well as our Stamford campus, Hartford campus, and Avery campus are going to be successful because of support and quality of the support that we provide to them. Regarding the Excel, when I mentioned Excel, I said if we have shortcut of this magnitude, everything is on the table. We want to support communities. We want to be in Hartford. We understand the pain of those small businesses, but when it comes to straight dollars, I will have my CFO to respond to that question.
Thank you. Thank you, Dr. Rudenko.
Yes,
Sir?
thank you. Thank you, Representative. We can get you detailed information, but on short, yes, we do pay rent to play at the Excel Center. So as the president said, that would be, one of many things we look at, but there is no immediate concern of changing what we do there, but we'll get you more information of that, especially in the subcommittee.
Thank you very much. Thank you, Madam Chair.
Thank you, Representative. Representative Exum.
Good afternoon. Thank you so much for being here, for your presentation, and thank you so much to the students for being here. It is wonderful to see your participation, and I know how much this means to you. Although I've lived here 25 years, I was well through college and never had the opportunity to attend a university here in Connecticut. But I do want to say, I have a question that as I was looking through some of the alternatives that were presented around the endowment piece, and I know there's so much UConn pride here. What is the plan around the endowment piece to try to enhance that? So that was the question I had for the university piece. And then I had one other comment that I just wanted to make about the medical center, where I've spent a good deal of time. I used to represent, I'm no longer part of Farmington, but just being so incredibly impressed with all that takes place there at the medical center around research, around the doctors, the clinical care, and really having people understand what it looks like and how you are, it's more difficult to be able to do recruiting when you have the fringe costs that impacts what people are attracted to. And I think also hearing a little bit about that, how it practically looks, would be helpful for people to understand. So I wanted to just kind of throw both of those out. I know went 2 different directions, but
Thank you, Representative Exum. Raising funding is number 1 priority besides of being with students for president, because we have to bring more funding to provide the quality of education that we want to provide. As I said, We have 280,000 graduates. 77% live in Connecticut, 25,000 in California. During my time as a president, I met with over 100 donors, if not more. And I'm sitting them and telling them the value and building the network and building appreciation what they have. And one excellent example is our chair of the board of trustee. His father was blue collar worker on the Pratt and Whitney floor. And he sent his son to UConn. And his son gives the money back for scholarships, for endowed faculty, and for athletics. And I'm looking for more donors who have a big heart and who want to give back. Tomorrow I'm going to meet with another donor who lives in Florida. And she said, my mother did 3 jobs and sent her 3 children to UConn. And because of that, I want to educate the future nurses. And I want your proposal. So our foundation CEO, myself, and the entire team are working very hard to make outreach and to present the value of UConn and also understand what people who graduated from UConn want to get from that relationship. We are very active with the industry and businesses, and they provide scholarships. So we are working on the multiple fronts, but all of that is going to take time. So our target is in 8 years to reach 1 billion. And I ask CEO, are we real? Can we do it? Because we don't want to repeat that number and not be able to deliver. And we are going to work 150%. I will wake every morning by 4 a.m. to make sure that happens.
Oh, fantastic. Thank you so much for that response. 8 years. And Dr. Lane?
Thank you.
Thank you, Representative.
Oh, okay,
Excellent.
go ahead.
I did 2
Yep.
quick ones.
Yep.
Is it okay?
Yep, please go, sir.
Thank you. Thank you very much for your kind and encouraging words. Good to see you here again. I just wanted to also mention to your question that we actually have doubled the clinical revenue at UConn Health in the last 10 years. And we did that by attracting outstanding faculty members. They come from all over the country. They bring their families, of course, themselves to Connecticut and strengthen us and Farmington. We provide excellent care. A recent patient of ours, whose wife was cared for by us in the cancer center, said to us that when his wife was having a brain metastasis, they said, well, why don't you go to somewhere else like Sloan Kettering? And so he called around, and the doctors at Sloan Kettering said, no, you don't need to come to us. You got one of your best cancer doctors right there in Farmington. You don't have to travel to New York. And he was very grateful, and he pledged, I think, President Merrick, if I'm not mistaken, $12 million.
That's correct.
To fund half of it to UConn Health, half of it to UConn. And so this is part of the philanthropy that we engage in. And we have also doubled our external research grants in the last 7 years, going from about 70 to close to 125 million. Not quite double, 80% increase. Just in 7 years, that's on our own. And as you know, we have an active collaboration with Jackson Lab, not including 125, it's $115 million of joint NIH grants with JAX. And that's been an excellent relationship. They're right there. And during the pandemic, we collaborated and performed 1.5 million COVID-19 testing. In those early days, the turnaround time was 36 hours. In many other testing places, including the CDC, was 1 week. And so it was another example of such collaboration. The medical and dental school class size have increased by 30% thanks to Bioscience Connecticut. And as mentioned earlier, we're the leading source of future doctors and dentists. And so we increase the class size, increase the denominator, so more of them end up staying here in Connecticut, serve this state. So I want to thank you personally for all your support over the last 10 years. Thank you very much.
Thank you so much. Thank you.
Thank you very much. Any other questions? Seeing none. Seeing none. We really appreciate everybody coming here today. we do have another briefing going on at 2:58. We need to sign on to for that. And you're all released to be as loud as you want to for the next 5 minutes. There you go.